It's estimated that it costs between $800,000 and $1.3 million to replace one physician who leaves the organization. I'm Dr. Christine Sinsky, and I'd like to tell you about a study that was recently published in the Mayo Clinic Proceedings on March 7th, 2025. The article is titled Association Between Vacation Characteristics and Career Intentions of U.S. Physicians. This was a cross-sectional study of a convenience sample through AMA's organizational biopsy. The background for this is that using a different data set, we had previously published data looking at vacation characteristics and burnout. And what we found was that physicians who took less than 3 weeks of vacation, who did not have full inbox coverage, and who worked while on a typical vacation day, worked on patient-related responsibilities, and particularly those who worked 30 minutes or more, had significantly higher rates of burnout. And each of those characteristics was independently associated with burnout. So in this study, we took this one step further and we looked to see what did those vacation characteristics have to say about career intentions. What was the association between those three characteristics and physicians' intentions to reduce their clinical effort in the next 12 months or to leave their current organization in the next 24 months? And so our sample then was over 5,000 physicians. Nearly half reported taking 15 days or less of vacation every year. Similarly, nearly half reported not having full inbox coverage while on vacation, and 72% reported having to do some kind of patient-related work on a typical vacation day, and a third of physicians reported doing 30 minutes or more of patient care activity on a typical vacation day. Those results were very similar to the earlier study that I had mentioned. And in this study, then, we went further and we looked to see how do those three vacation characteristics relate to work intentions. And we found that each of those characteristics was independently associated with a higher odds of intending to leave one's organization, as well as a higher odds of intending to reduce one's clinical effort. And so why does this matter? Well, these results matter because there is a physician shortage, and they matter because it's very expensive to replace a physician. And so health system leaders can look at this data and come up with actionable steps to reduce burnout and to reduce the loss of physician capacity due to either reduction in clinical effort or to leaving the organization. So what's actionable? Well, organizational leaders can institute infrastructures that help to measure and incent the taking of vacation. This can be cultural and it can be operational. In addition, leaders can ensure that there is a systematic way that physicians have inbox coverage when they're on vacation, so that physicians don't have to ask a partner to seemingly impose on a partner to cover their inbox while they're gone. We know that that's a barrier to physicians actually taking their allotted vacation. And then systems can be set in place so that physicians know that their patients will be cared for in their absence, so that physicians don't feel that the only way that they can keep their patients safe is to continually check in and manage their inbox while they're gone. In addition, systems can be put in place so that physicians on return to work don't feel overwhelmed by an overflowing inbox, either by having a half day dedicated to cleaning up that inbox, to catching up, if you will, or having enough coverage so that when the physician returns, they are not facing an extraordinary amount of inbox work. So those are the results from our study looking at vacation characteristics and career intentions of U.S. physicians, and thank you so much.
We hope that you found this presentation from the content of our website valuable. Our journal's mission is to promote the best interests of patients by advancing the knowledge and professionalism of the physician community. If you are interested in more information about us, our homepage is www.mayoclinicproceedings.org. There you'll find access to information for our social media content, such as additional videos on our YouTube channel, www.youtube.com Mayo Proceedings, or journal updates on Facebook, www.facebook.com Mayo Clinic Proceedings. You can also follow us on X, formerly known as Twitter, available at Mayo Proceedings. More information about healthcare at Mayo Clinic is available at www.mayoclinic.org. This content is copyrighted by Mayo Foundation for Medical Education and Research, published by Elsevier Incorporated. All rights are reserved, including those for text and data mining, AI training, and similar technologies.